Okay, let's take
That feeling where your thoughts scare you or make life tough. Sometimes it feels like no one else in the world has those thoughts or feelings. No one seems to know how difficult it is to deal with your feelings. And it's not easy to share your deepest secrets. You might think something is wrong with you, or you might worry what other people think. And all of that makes your thoughts and feelings worse. Our culture has created this environment of shame. Until the 1960s, society sent people away if they had challenges managing their thoughts, emotions, and behaviors. Over time, we learned that we didn't have to be afraid. We learned how to help people get better. We became hopeful. But there are remnants of those images in our culture today, which is why some people still feel uncomfortable talking about it. The stigma has taken new forms too. With more access to more people all the time, it can seem like the world is telling us it's not okay to be anything but perfect. The truth is, everyone has thoughts or feelings that can be hard to deal with. So why do we make it so difficult on ourselves by judging others who could be going through the same challenges we are? What if, instead of seeing labels, we saw people who are struggling and could be there for them so they didn't feel so alone? What if we looked past our fear of mental health and started to talk about it in a constructive way? What if, as a society, we used empowering words and healthy images to help people feel supported? Maybe then more of us could feel comfortable telling others when we're having a hard time. Maybe more people would get the help they need. And maybe one day we won't have to talk separately about mental health and physical health, but just health. The truth is, each of us has the power to change our culture. Will you join us? Share.
Okay, I just wanted to share a little bit of that video, especially because it talks about just being comfortable and being able to accept different people's mental health, whether it's in a good place or sometimes if they're just having a hard time, to really come out and speak about it. So it's very important that we share that, okay? So we're kind of coming to the end of our presentation, but I just kind of want to show you guys a last part of our slides. Give Miss Josie a second. Okay, here we go. Just pull it up for you guys. I just kind of want you guys to start thinking after talking about mental health and watching the video. What do you do for your mental health? What do you do to feel good in your mind and in your body? And what practices can you start doing more of? Okay, so it's not only just talking about it with other people, but where could we start to start making ourselves feel better so that we feel good? And of course, there's no wrong way of expressing how we take care of our mental health, but just find what works best for you. Okay, so I just really want to talk about this topic this month because it was really huge for the month of May. So I hope all you guys start practicing some coping skills that works best for you, and then I'll see you guys next week. I hope you guys have a wonderful rest of your week.